Now, live from the Channel 11 studios, it's Great Day Houston. And here's your host, Whitney Casey.
The pain for our next guest became worse following back surgery, but prescribed pain medication only added to his pain. Welcome Robert Whitley and Dr. Ioannis Skaribas, a pain management specialist. Also joining us again is Dr. Pamela Blake, who is in our audience. So you had the suggestion to do surgery to take care of your pain. What kind of pain was it and how was it caused?
About 10 years ago, I was told I had degenerative bone disease. And I couldn't find a doctor that would even operate on me. They said it wouldn't do any good. So I went on a journey of 10 years of shots, medication, therapy. Nothing helped. And I finally was on such strong medication that the last thing I had was OxyContin. I just became a zombie, depressed and not able to function.
And so you had the choice of not functioning and being depressed or dealing full on with the pain, and neither one of them really was an option. Nothing
did any good. And I went 10 years through that procedure with nothing helping. And I saw Dr. Skaribas had a program at the hospital where he is working, and I couldn't make it to the seminar that he was giving, but I called his office and went in, and he can tell you what he did for me.
All right, Dr. Skaribas?
Yes, so what I did for Robert is called spinal cord stimulation. Robert has two active leads up into his thoracic epidural space. And it's connected, everything is internally, to a generator, and that stimulates his spine to stop receiving painful stimulation from the areas that hurts. And he's completely pain-free, and he's not chemically dependent anymore. He just came actually back from vacation from Hawaii yesterday.
Well, look at you.
50th year anniversary.
For you what now?
50th year
50th anniversary. And you're acting like a spring chicken again now that your back is acting right. Did you really think this would work after years of disappointment, or you would try anything at this point?
Well, the surgery didn't work last year that I had, and that doctor had told me that he didn't think it was going to even be 50%. It might be 20 or 30% relief, because there's no cure for degenerative bone disease. And I have the same thing in my foot, that I've had 2 surgeries and removed 3 bones. And this implant is like a wonderful massage. It's electrical impulse, and it takes away all the pain.
How long did it take to work for you?
Immediately.
That's incredible.
Yes, it is. It worked within the first 24 hours. Actually, we kept Robert, we do a trial first, so we kept him for several days because we want to make sure he doesn't have any placebo effect. We implanted him, and he's been pain-free, reclaimed his life without any medications, away from narcotics, and moved on.
It's doing good.
This is exactly what Robert has implanted into his
the whole device, or?
buttock area, and this is actually what he has. There is smaller devices, as small as this.
Lift that up.
This was what was appropriate for him, and it's connected to 2 leads looking exactly like this one. It is like having an the procedure is like an epidural when you do the trial. Implanting this device involves a very brief outpatient procedure. The patient at all times is sedated but awake.
And what's the success rate? You know, we know it's surgery. You never know many times what's going to happen for sure.
It's a very good question. There have been actually studies done by neurosurgeons, validated studies that we see that the success rate with spinal cord stimulation is better than repeated surgery for back pain. So it is pretty high. The success rate is very, very good. And of course, it's implanted only if this trial works for the patient.
And if the trial works, so does the person get to have this for the rest of their life, or will you go back in and put another one in, or can this be is this their cure, so to speak?
Yes, for their pain. Not for their disease. This treats the pain. Degenerative disease of the spine, the only way to change the anatomy is surgery, and pretty much that's like a lot of times flipping a coin as far as whether it's going to be successful or not. Yes, this is a lifelong treatment. These devices last up to 10 to 15 years, and they can be they're rechargeable. Some of them can be replaced just with a very simple incision and an outpatient procedure.
Wow.
It's not lasting more than half an hour.
This is awesome. But Dr. Blake, a lot of people do resort to painkillers and kind of misunderstand how they work. I have a friend who, for years, took painkillers, ended up in rehab because he became addicted.
Right.
And he found that, and he's like down in 43 Vicodin a day, but he found that his pain level actually was less when he was off of the pain medication.
That's correct, and certainly in headache, and I think also in other causes of pain, there's a cruel phenomenon in which the more medication you take, the more medication you need, and your body will start to almost turn up the volume of the pain, so you keep taking more and more. The brain responds to ongoing exposure to narcotics by making more and more receptors for that narcotic to interact with, and so you need to take more and more to get the same kind of pain effect. And then depending on the person's underlying personality, some people may find that the mood elevating or the way that the drugs make them feel psychologically is something that is good for them. It's not, of course, but they'll use that. So some people will become addicted psychologically to the medication, which is a little different from being physiologically dependent on the drug.
Right.
And that's something that I, as a doctor, I do use medications like this for pain, hopefully as a short-term treatment while we're pursuing more permanent things like what Dr. Skaribas is talking about.
And it's very much regulated when you're dealing with it.
It's very closely regulated. If there's any suggestion that the person is benefiting or using the mood effect, they need to be seeing a psychiatrist. I need to have ongoing updates from the psychiatrist. And again, I view this as a short-term thing while we're going through the process of a more permanent, hopefully, relief of their pain.
And try to find the cause.
Absolutely.
Thank you very much. Thank you, gentlemen.
Thank you.
That little twinkle in your eye there, that 50th anniversary. All right, coming up, if surgery and medication can't take care of your pain, what options do you have? We'll look at alternative methods that are helping people to manage their pain as well.